Now, some people say lost in all this talk about guns and ammunition is a good hard look at mental health treatment in our state and across the country.
There is a provision in the new gun law proposal that will make it more difficult for mentally ill patients to get a gun. But that really only scratches the surface. News 8's Bob Wilson is live in Hartford with a look at what's next for lawmakers. Bob?
And as complex as gun control is, mental health is a whole nother world. And that's why they're going to take their time and go through this bit by bit. We caught up with some of the experts who are involved in the lawmaking decisions. The first glimpse of mental health reform appears in the new proposed gun control laws, and it deals with the people who are committed to psychiatric hospitals. For involuntary committals, under current law, an individual who has been involuntarily committed to such a hospital within the previous 12 months can neither possess a firearm nor receive a permit or eligibility certificate. The bill expands that look-back period to about 60 months. Voluntary admissions. Current law does not address voluntary admissions. Under the bill, an individual who has been so admitted will not be able to receive a permit or eligibility certificate for 6 months thereafter, nor will they be eligible to possess any firearm for those 6 months.
Reporting of individuals who have been voluntarily hospitalized, I think, are actually quite controversial. It would be very unfortunate if an unintended consequence was that people avoided coming into care out of fear.
Dr. Harold Schwartz sits on the Governor's Sandy Hook Advisory Commission. He says guns and school safety were the first priority. Now the commission will take on mental health.
We're just starting our work on mental health now with the hope that some of our recommendations can still make it into legislation in this legislative season.
Substance abuse services is another thing that sometimes gets left out of the mental health picture.
Dr. Rowe from St. Francis Hospital says the mental health is extremely complex, and that includes the addiction problems.
They'd never be doing any violent crimes if they weren't drinking, if they weren't, using cocaine or PCP.
Now, Dr. Schwartz says if it doesn't get brought forth in this legislative cycle, he says there is plenty of time still. They are working on it. They are moving forward with mental health reform. It is just such an enormous task that it can't necessarily be just done in a couple of months like gun control. They say it could take years to get this all under control. I'm Bob Wilson, reporting live in Hartford, News 8.